What is COVID-19? Coronavirus disease, or COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected will experience mild to moderate respiratory illness. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. How does it spread? A person can get infected by physical human contact or by touching a surface or object that has the virus on it, and then touching his or her own mouth, nose, or possibly their eyes. According to the CDC, the virus most commonly spreads between people who are in close contact, within about 6 feet or 2 arms length. It typically spreads through respiratory droplets or small particles such as those in aerosols, produced when an infected person coughs, sneezes, sings, talks, or breathes. The virus can spread by asymptomatic people as well. Asymptomatic carriers may have very mild symptoms or show no symptoms at all. What are the symptoms? Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19, fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body ache, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. This list does not include all possible symptoms. The CDC will continue to update this list as we learn more about COVID-19, protecting yourself and coworkers. You may be wondering, how can I help reduce the spread of COVID-19 in the workplace? On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Always self-screen prior to work. Contact your supervisor if you are experiencing any symptoms of COVID-19 or believe you have been exposed to someone with COVID-19. Contact your medical provider immediately if you have trouble breathing, tightness in your chest, confusion, bluish lips or face. Thank you for doing your part in keeping both you and your coworkers safe. How do I prevent spreading in the workplace? Maintain separation. Wear a mask. Wash your hands frequently. Cover coughs and sneezes. Disinfect hard surfaces and high-touch items. Please look for and follow any new training or additional PPE requirements that have been implemented. Contact your site supervisor or local office immediately if you notice any hazards or feel unsafe at work. Personal protective equipment, or PPE. COVID-19 has created new hazards in the workplace, and there may be new protocols requiring the use of personal protective equipment, or PPE. Some of the more common types include face coverings and gloves. Cloth face coverings. Cloth face coverings should fit snug but comfortably against the side of your face, over your nose, and under your chin. Your mask should include multiple layers of fabric, allow breathing without restrictions, be washable and dryable without damage. When removing your mask, avoid touching your eyes, nose, or mouth. For tips on how to make your own cloth mask, visit the CDC website. At times when social distancing rules are unable to be maintained, face shields may be used as a precautionary measure to avoid exposure to the virus. Gloves may be recommended for certain tasks, handling chemicals, wiping down surfaces during high-exposure jobs when mandated by local health agencies. Important note, Based on CDC findings, gloves can put employees at a higher risk of exposure due to a false sense of security. Always remember, regardless of the PPE you are wearing, washing your hands frequently is the #1 defense against any virus. What else can I do? Safety for our associates is our #1 priority. We follow all CDC and EPA guidance when determining the appropriate cleaning supplies. We recommend having these supplies for proper machine and workstation cleaning: nitrile gloves, face mask, cloth face covering, clean safety glasses, hand sanitizer, disinfectant or alcohol wipes. Use proper PPE at all times while cleaning. It is extremely important to clean and sanitize all workstations and machines before and after each use. Wipe down and sanitize all forklift trucks, work areas, and work tools before starting work. Handles, control levers, steering wheel, hood and hood release levers, locks and keys, seat belt, rails and armrests, harness, battery connectors, floor mat, and all other high-touch surfaces. Don't forget communication radios, scanners, keyboards, pin pads, and operator displays, and plexiglass shields. Important! Remember to maintain records every time you clean and sanitize all areas and equipment. To keep your family safe, execute daily disinfecting and cleaning routines for high-touch areas and items. Wash your hands frequently, especially upon returning home from work and other activities. Avoid gathering in large groups and consider other options as a substitute for public transportation or ride-sharing services. Want to learn more? Contact your local office or visit us at our website. We will get through this together, working smart and staying healthy.